So I am a nurse, and currently I work as a pediatric oncology nurse at Hospital Infantil Teletón de Oncología in Querétaro, Mexico. It is a hospital that exclusively treats children with cancer. And currently I work at the bone marrow transplant unit. Children with cancer are very different from normal kids. They are like little adults, because they are very tough and strong, but still have the essence of a child because they are very innocent and playful. And yeah, I think those are the strongest people I've ever met. Them and their parents, of course.
Hi, everyone. Thank you for joining our Crafting Wellness podcast. And today I have the pleasure of introducing you to Valeria. Hello, Valeria. How are you?
Hi, Brooke. I'm doing very well. Thank you for inviting me today.
Oh, thank you so much for joining us. So can you kind of just give us a little introduction of yourself? Just let everybody get to know you a little bit.
Yes. So I am a nurse, and currently I work as a pediatric oncology nurse at Hospital Infantil Teletón de Oncología in Querétaro, Mexico. It is a hospital that exclusively treats children with cancer. And currently I work at the bone marrow transplant unit.
Wow. So how long have you been doing this job?
This job for almost 2 years now.
And that has to be an incredibly difficult, but also incredibly inspiring and beautiful job to have.
Yes, it is. Yes.
Can you tell us a little bit about how you found this job, like how you got into nursing?
Yes, so I studied at Universidad Autónoma de Querétaro, which is a public university in my state, but actually the best one for nursing in Querétaro. I studied for 4 years, and then after graduating, I started to work as a school nurse. And then also the other half of the time, I used to work with a pediatrician in a consultory. And even then, I didn't see myself working with kids for my whole life. It wasn't until I started to work at ITO, which is where I work now, that I found myself loving kids. And I guess it's because children with cancer are so much different from normal kids, I guess.
Yeah, I bet. So when you were a school nurse, was that like elementary school, like younger kids as well?
Yes, well, it was a school for since kindergarten to high school.
Then you went to work in pediatrics?
Yes.
Okay. And then, so how did you kind of find the specialty with kids? I just wonder how you even come across oncology nursing with children.
Yeah, I think it's like a funny story because when I was studying nursing and I went to my clinicals, I remember when I was doing pediatrics as a clinical, I thought I'm never going to work with kids. Like I thought it wasn't for me, But then my first job as a nurse was a school nurse, and then I used to work with a pediatrician. And as I told you before, even then I didn't think I was going to work with kids for my whole life. But then I have a friend who works at the hospital that I work at, and he told me about the job, and I just applied, and I don't know, I just fell in love with the kids in there and the job.
I love that so much. I know I've seen on your Instagram page just how beautiful of a job that is to kind of be there for them during such a difficult time. So as a pediatric oncology nurse, can you tell us a little bit about the day in the life of you?
Yeah, so, well, it's like very different every day. I mean, it's not the same, but we kind of get assigned our patients. We can just have maximum 4 patients because the kids are like very complex. So we can apply chemotherapy, or they can get critical pretty easily. So we have to be like super paying attention to them. They also get like a lot of transfusions and procedures. So I think it's different like every day. But right now I work at the bone marrow transplant unit, and it's a little more like it's very different from the normal hospitalization for the kids.
Talk a little bit about the bone marrow transplant unit and what that entails.
So bone marrow transplant is also called stem cell transplant, and it is a therapy for children with cancer, mostly leukemia, but not exclusively for leukemia. And it is the infusion of healthy bone marrow into the body to stimulate new bone marrow growth. It is like a pretty complex therapy. We have to give the children high doses of chemotherapy to condition the body to make space for the new bone marrow. And so kids also get like very immunocompromised. So we have to take a lot of infection control. And yeah, so there are two types of bone marrow transplant. Is the autologous, which the own patient like kind of donates their own stem cells. And there's also the transplant, and it can be from a family donor or someone that is not related, but it's matched to it.
I imagine it's a pretty stressful job because you're dealing with really innocent life and very young life. And so I can imagine that doing that job kind of can be emotionally draining. Can you talk a little bit about what you do for yourself to kind of balance when you have difficult days and kind of how you get through those?
Yeah, I think I'm very tough, I would say, because like I haven't had like very issues with that, dealing with that, like I'm very good with separating job and my personal life, I guess. Of course, sometimes if my patient is not feeling well, I don't feel well, and then I go home with like the feeling of knowing that my patient wasn't doing well or probably isn't in the time.
I think that's really a great perspective to have, and the more you can kind of separate that as best you can, because I know it's probably difficult to do. It's only going to make you stronger and a better nurse because you can just kind of separate those hard days and feelings. Was there kind of a special studying for this to become a pediatric oncology nurse?
Well, like of course there's like a course or like a special like 2 years of preparation or less. But I didn't. Like I just went to work into this hospital and I kind of trained in the hospital, and that's how I literally become one, like by training every day, and still I'm like learning every day.
Can you tell us where you are right now? Because I think I know where you are, but I don't think anybody watching knows where you are.
Yes. Right now I'm in Mexico, in Querétaro specifically, which is a state that is like 3 hours away from Mexico City.
So, can you tell us a little bit about just about you and like what you like to do for fun and what life is like there for you in Mexico?
So, I mean, I don't think I have like a super fun life. Like when I work in the afternoons actually. So during the morning, I don't actually have time for like a lot of things, but I kind of like to exercise and spend time with my dogs, with my family. And then I go to work. I work for 8 hours and then I come home super tired and I just go to sleep. But I think my favorite thing to do and what I'm most passionate about is traveling.
Oh, yes, traveling. So where have you been that's your favorite place that you've traveled to?
Yeah, so when I graduated from nursing school in 2017, I traveled with my best friend who also had graduated as a nutritionist. So we went on a trip to Southeast Asia. It was like the best trip I've ever made. And I think my favorite country that I visited in that trip was Thailand.
Oh yeah, I've never been to Thailand, but I've seen pictures and it seems extremely beautiful.
Yeah, like the landscapes are amazing, the people are super nice, and the food is delicious.
Yeah, that's awesome. Okay, so what is your bucket list travel? Where's your next when COVID is over and you have time because you've earned it through all of this? Where is the place that you want to go to next?
I have a dream to go to Peru, to Machu Picchu someday.
Oh,
And
yeah.
I also want to go to Africa, to a safari. I don't know, there's just like a lot of places that I want to visit.
Did you grow up in Mexico? Is that where you're originally from?
Yes, I've been living here for my whole life. I just did a semester abroad during nursing school. I went to Hope College in Michigan. I studied there for 6 months. And actually, that's when I realized how different nursing is in the USA from nursing in Mexico. And that experience actually made me want to become a nurse in the USA. Hopefully, sometime soon. I'm just a little bit scared about the NCLEX.
Oh, yes, yes, the NCLEX. I know that's a hard test that everybody studies.
Yeah.
I know, but I think you can do it. I believe in you. Um, that's an interesting point. I would love to hear a little bit more about your experience when you came here to the U.S. To study abroad in Michigan. Can you explain a little bit about that experience and about how it is different?
Yes. So when I went to nursing school in Michigan for just 6 months, um, yeah, I realized how different everything was. Like, for example, the college life is so much different. Here in Mexico, I live at home and I just went to college. And also, I remember in Mexico, when I used to say I was studying nursing, people would ask me, like, but why didn't you study to be a doctor instead? You know, like making nurses be less than a doctor, because that's how nurses are seen in Mexico, more like an assistant for the doctor rather than a teammate.
Mhm.
And I remember when I was in Michigan and people would ask me about my major and I would say nursing, I would always hear some very positive comments like, wow, you must be super intelligent. Wow, nursing is super hard. And that made me realize how nurses are seen. And that's actually how I want to be seen as, because it's true.
It's absolutely true. I have spoken to so many nurses who were on the path to become doctors, who got into medical school, who were doing that, and then changed their mind. There's definitely a certain calling that nurses have, that they're there for you during the most difficult times of your life and sometimes the most happy times of your life. But they're the kind of there for you when you're scared and alone, and they kind of just feel like an angel, like they're called angels of healthcare for a reason, because uh, they definitely feel like that. I know that as myself, as being a patient in the past, I had an amazing nurse when I was in the emergency room when I was young. I was in California by myself, and I woke up in the ER, and I had this amazing, kind nurse who like put socks on my feet, and he was the kindest soul to me, and he comforted me in a way that I couldn't explain because I was away from my family and didn't know what was wrong with me, and just the care and the love and the just knowing that he was great at his job and he could take care of me, and it just brought a level of comfort I can't express, and that's kind of where my love for nurses came from. So it's definitely a genuine love, but I think you make a really great point that nurses aren't assistants or a teammate, and we need everyone in order to do their jobs, in order to get people healthy and on the right track. And every role is just as important.
Yeah, that's what I think so too. Yeah, when people ask why didn't I study to be a doctor instead, it's I just say it's very different. Like, it's not that they are more than us or anything. It's just very different.
If you have any advice for people who are interested in getting into nursing and or maybe getting into specifically pediatric oncology nursing, do you have any advice for those people who are watching this video right now who kind of want to know?
So I would say the healthcare path is like very complex and difficult sometimes, but it's totally worth it. And I would say just explore the like specialties, like look for the ER, surgery, um, pediatrics, and then get to know where is your place. That I wanted to be in surgery, but then I found myself working with kids was my place to be.
Yeah, I think it's a lot of like trial and error, right? Pediatric oncology nursing. And then you could try to start that path and then realize, you know what? No, actually I want to go into surgery, or I want to go into this other specialty. Because I think with nursing, the important thing to remember is there's so many different paths that you can go down, so many different specialties. And I'm kind of learning it along while I do this podcast, speaking with all different kinds of nurses, kind of learning all about the specialties. And it's really fun because I'm learning along with everybody watching as well, all the options that you guys have when it comes to pursuing nursing. And also when it comes to pursuing how high you want to take the nursing education, because you can do 2 years, 4 years, you can just keep going and learning and growing as a nurse. And I think that's one of the most beautiful things about nursing, is that you have the control to exactly choose whatever path you want and to take your education as far or as little as you want. And it's just up to you.
Yeah, I agree with you, Brooke. Yeah, nursing is like very diverse. You can go to the bone marrow transplant or the ICU. I mean, it's like very diverse for nurses.
I'd love to just ask you to come over here to become a nurse over here in the States. Do you know what that process is like, or is that something you're currently pursuing, or just a dream that you want to pursue in the future?
Yeah, I know the process. It's pretty complex, and that's probably why I haven't done it. First, I have to kind of revalidate my studies. So I have to do something in the CF and GS thing. I don't really know very well. And also, of course, I have to the NCLEX. And then when I have like the RN licensure, that's how it's called.
Mm-hmm.
I would then just apply for a job. And it sounds super easy, like by just saying it, but doing it's a challenge.
Have you ever thought about travel nursing? Because here in the US, travel nurses, they kind of get to pick up and go to different places and work for short periods of time, sometimes 6 months, sometimes longer, and then they pick up and then they go somewhere else. Have you ever thought about that, or is that just completely separate from your specialty?
Well, that's not something we do in Mexico, but I learned about it when I was in Michigan. I knew that was a thing, and I always thought that was very cool. But I don't know, I have never thought about going into that path.
Mm-hmm.
I just felt like I found what I want to do with my life, which is pediatric. Like, I don't see myself doing anything else anymore. If I ever go to the US, I would totally want to work as a pediatric oncology nurse somewhere else.
I love that. I love that you know
Yeah.
what you want. And it's funny because the more people I talk to, it's like once they find their kind of niche, once they find their spot where they're like, their heart tells them, this is it. Like, I know where I'm supposed to be. And then there's no really other thing. It's like you just know. And after speaking with you, I can tell you're exactly where you're supposed to be and where you're meant to be and where your heart has led you. So I think that's really beautiful. And I know that all those children are so lucky to have you and have a caring nurse by their side helping them through all their battles, because I know that that's not easy to go through.
Yeah, thank you, Rook. Yes, children with cancer are very different from normal kids. They are like little adults, because they are very tough and strong, but still have the essence of a child because they are very innocent and playful. And yeah, I think those are the strongest people I've ever met. Them and their parents, of course.
I've enjoyed having you so much on this podcast, and I definitely want to link all of your information. We're going to put her Instagram handle in here and any other handles that she might have down in this video below. So please go check Valeria out. I know that if you have any questions or want to chat with her, I'm sure that she's open to talking with you guys. If you want to learn more about pediatric oncology nursing, I'm sure she'd be happy to tell you what that experience is like.
Thank you so much, Brooke.
Thank you so much for joining our Crafting Wellness podcast.